The one most important thing to ever say to a patient about liposuction is that it does not treat cellulite. Cellulite is very superficial in the skin, as we all know. We can see it across the room. It catches light because of its quality, and it's caused by these little fibrous bands that hold the skin and dent it as the skin sort of sags. And that's exactly what cellulite is. When we do liposuction, we just take out the deep fat. We don't get our cannulas anywhere near that superficial skin surface, because if we did, trying to break up the cellulite, it would just create more cellulite and probably dents and irregularities in the skin. So think about liposuction as reshaping the body, the legs, the thighs, the abdomen, the arms, anywhere you're treating it, but actually not truly affecting your skin too much. We have other ways to treat cellulite. The combination of liposuction for surgery and one of our non-surgical cellulite treatments is a fantastic combination to make women feel much more confident in their shorts and in their bathing suits. You know, often patients come in with concerns about fat in their, maybe in their thighs, in their hips, in their abdomen, especially in their abdomen, and they want to do liposuction to fix that. The truth is, liposuction removes fat, and when we remove fat, it doesn't firm up skin, it actually makes it looser. So when somebody has looseness to the skin, that's the one most important thing we're evaluating to determine whether liposuction is actually going to be good for them. We do not want to take out fat and then make the skin looser. So many patients who come in after 3 children complaining about loose skin in their belly and fat, often that requires something more like a tummy tuck, because we need to take out that extra skin. Likewise, when somebody's had large weight fluctuations or weight loss, and they come in showing me their thighs or their hips or buttocks, and they feel like it's fat because they can grab it and it seems like fat, but it's also loose skin, it's impossible to fix that with liposuction alone. In those situations, we often have to do thigh lifts or buttocks lifts or body lifts in order to correct that. So just remember, liposuction in of itself doesn't make the loose skin tighter. It can actually make it looser. So we'd be very cautious when choosing liposuction. The skin can tolerate it very well. Why liposuction works is because when you take that fat out, your body really doesn't have any ability to produce that fat anymore. And so fat removal by liposuction is permanent. The problem with it is that in places that you didn't liposuction, or some of the fat you left behind when you liposuction an area, the fat cells that are left behind can get larger and you can gain weight. So liposuction is not a weight loss program. It is a way to reshape the body, reshape the thighs, the abdomen, the hips and the back, arms, and make them look better and look more proportional and shaped right and contoured and thinner. That's what liposuction does extremely well. So it's really important to know that when you take fat out, it doesn't return, it doesn't come back in those areas. Your body does not have the ability to produce more fat cells. So once they're gone, they are really gone. Just remember that fat in the other areas of your body, if you gain weight, those fat cells will enlarge. You don't get more of them, but they enlarge and you can actually get fuller in other areas. So it's really, really important to keep your weight stable after liposuction. And if you do, you will have stable results. If you gain weight, and a lot of weight, then often you're going to see some fullness in areas that maybe you did not see it before. Some patients think when they get liposuction that they can jump right back at it. You have to recover. Even though there's only tiny scars, it can give you the impression that there's no scars, there was no surgery. But the truth is, under the skin, there's a big area that's been sort of injured because of the liposuction, and you'll be bruising, and it will require recovery. That being said, compared to other operations that we do, there is really nothing that can break apart or open up. And so our patients can get back to activities much faster than they can from other procedures like tummy tucks and facelifts. So there is some recovery from liposuction, but on the other side of it, it's a quick recovery and you can get back very quickly and really have amazing results. And we want people to get back because we want them to get back to exercise and to a good, healthy lifestyle to maintain their great results after liposuction. Well, it's kind of a myth that liposuction can help you lose weight because liposuction is not a weight loss program. But that being said, when I take fat cells out and when I liposuction, especially if it's larger areas, then patients will lose weight from that, right? So you will lose weight, you really lose fat, and the areas will get smaller and your weight will go down. The problem is, if you're not careful, you'll kind of gain your weight back. It just won't be in those areas where you had the liposuction. It will be in other areas too. So you can still gain weight. So the worst time to do liposuction on a patient is when they're gaining weight and they keep gaining it and they go, uh-oh, I need to do liposuction to make that better. That can not work out so well. It's really important to have stable weight and or maybe be losing some weight. It's all going in the right direction. And then if you add liposuction to really remove more of that fat, and especially in the areas that you don't want it, then that combination can really create dramatic results. I personally love liposuction. I use liposuction in almost every operation I do, including tummy tucks and breast reductions and breast lifts and face lifts and in body contouring for sure and thigh lifts. In all of those areas, I'm always using liposuction. I kind of think of liposuction as another tool in the operating room. So it'll allow me to get to areas without making scars. So we will do some incisions, but we'll try to keep the incisions shorter and then use liposuction to contour far away from that to get the final best shape. Liposuction is an amazing way to improve the overall aesthetics of almost everything we do in cosmetic surgery.